Well, America's top doctor concedes his country is dealing with the coronavirus crisis because the US never locked down as effectively as Australia. Dr. Anthony Fauci has held online talks with our Chief Medical Officer, Professor Paul Kelly, arguing the United States had lost control of the virus.
When Australia locked down, they really did. They got the level down very, very low. If you look at the monitoring of how well we locked down, we never really locked down completely. We had a terrible economic impact, but we never really locked down as well or as completely as Australia did. And I think a combination of the other things that Australia did correctly really led to the fact that they've done really quite well when you compare them to other countries in the world.
Joining us live now is Natasha Robinson, the health editor at the Australian newspaper. Natasha, appreciate your time. For all the criticism around today about the pace of the rollout of the vaccine here in Australia, when you look at that big picture, Dr. Fauci's spot on there, that Australia has done remarkably well.
Oh, absolutely. In world terms, we've done incredibly well. And part of that is to do with those early decisions that were made. As Anthony Fauci acknowledged this morning in that conversation that he had with our Chief Medical Officer, Paul Kelly. It was a decision, I think, to close the borders that was really critical, and that was made pretty early on. If you remember back to that time, it seemed such a radical thing to do. At the time, we were really one of the first countries in the world to do so, but it made such a huge difference. And I think one of the other things that Dr. Fauci was pointing out there is you know, when these lockdowns happened, it's not just a case of whether the government sort of has done all it can to lock the country down. It's really a case of compliance as well. And you saw, you know, very, very strong compliance with the lockdown measures in Australia. People really took on that message of social distancing, staying at home, even when masks were introduced, you know, everybody sort of wearing them. It's very rare to see anyone on public transport not wearing a mask in New South Wales and other places, of course. And so I think that a combination of the government decisions, but also those cultural factors, I think there was a much greater resistance in America to, you know, the interference of personal liberties, I guess, with the lockdowns, and that didn't really sit that well with the American culture generally for some quarters of the population.
Natasha, I was interested to see in your piece today some comments from the Chief Medical Officer, Paul Kelly, about Australians' tolerance now for new cases going forward. Essentially, he seemed to be saying that as we do open up, we are going to have to expect to see case numbers will rise with that, and we need to essentially start wrapping our heads around that if we do want to return to some sort of semblance of normality.
Yeah, that's right. He referred to the fact that they're going to have a conversation with the Australian people about this. I think the way that it will pan out is in line with what the government's broad goals are with the vaccination program. Their goal has always been to prevent hospitalisation and severe disease and death from coronavirus. So I think once the bulk of the population is vaccinated, they will be quite comfortable seeing those case numbers start to emerge again, because when you've got a population that is vaccinated, the cases that you're going to be seeing are going to be much more likely to be cases of mild illness. So they're not sort of all that concerned if we've got people who have the illness, but they are not overwhelming our hospitals and they're not becoming critically ill themselves. I think that the strategy is going to be that we need to start to be comfortable with the fact that we will see cases, and we've been so used to seeing no cases. That's going to be quite an adjustment for the Australian population, but it's certainly a conversation that Professor Kelly indicated that we're going to have to start to have in the coming months as the vaccination program really gathers pace.
We've spoken with a couple of medical professionals during the program over the last couple of hours, and we've been speaking a lot about the slow pace of the vaccine rollout. I spoke with an infectious diseases specialist around half an hour ago, and he said, look, within his sector, among his peers, there is a lot of criticism that the government had a lot of time to plan for this, and there is some disappointment that it hasn't been going as quickly as they would like it to. Is that the sense that you're hearing from the experts that you're in contact with all the time?
Yeah, look, I think the people that I am speaking to aren't overly concerned about the slow pace in these initial weeks. There's been a combination of reasons for that, really. The rollout in nursing homes has been really slowed by that problem that we saw in Brisbane and the contractor who was administering jabs in Queensland and New South Wales having to slow down because of the circumstances associated with those dosing errors. And then at the same time, you've had these issues in Europe where we haven't been getting our full sort of shipments of vaccine coming from Europe because Italy's blocked it and what have you. So I think there's a combination of reasons for the slow rollout. The government always said we would start slowly and scale up quickly. I think it is quite unfortunate that they set that target of sort of, around 4 million people vaccinated by early April. They initially said by end of March, and then that changed to early April. Now, there's absolutely no way that we're going to reach that target. 100,000 vaccinated now, and it's already almost mid-March. I think that was rather sort of foolish that they set that 4 million sort of mark as a target for early April, because it does give this perception that what's going wrong with the rollout? Why isn't it proceeding at pace? And I think that's a really unhelpful sort of narrative around the vaccine rollout at this point in time. The government is saying that they do believe that we're going to be able to stick to that broader goal that we have of everyone in the population who wants a vaccine vaccinated by October. But even then, setting those targets, it is an ambitious target. And, I'm not quite sure of the reason for it. I think it would probably be more realistic to say, look, let's get everyone vaccinated within this year, rather than this sort of arbitrary time frame of October. I don't think that there's a real overriding reason for it. And I don't think we should be putting that kind of pressure on ourselves, especially with no cases. But of course it would, we do want to see that vaccination program ramp up and start to roll out a lot more quickly than it has been in these early weeks. I think once the supplies from the onshore production by CSL start to roll through, you'll obviously see a huge picking up of pace, and hopefully they'll be able to bring things back on track in terms of those targets.
Fingers crossed. Natasha Robinson, appreciate you joining us. Thank you.
Thanks, Ash.